All right, let's go outside of the studio to Yale University via the Google Hangout to talk to Dr. Mark Brackett, the director of the Yale Center for Emotional Intelligence. And first, Doctor, let me say thanks for coming back to the show. We appreciate it. This is your second time on. And first, I'll ask you, what do you see being done across the country to address the issues we just heard about, access, stigma, other things that are preventing folks from getting what they need?
So, the approach that we take at our center is that every child really deserves an education in social and emotional skills. And we're part of a network of educators and policymakers who really are pushing for the whole education of a child. And so the field of social and emotional learning was really born to make sure that every child gets that education.
When does that education have to start? We've talked on Stay Tuned about starting young with our kids when it comes to nutrition and the fight against obesity. When does that education that you're talking about need to start?
So, I make a joke, it has to start in the womb, but in all seriousness, we like to start as early as possible. The work we do at our center now begins around age 3 in preschool. And our goal is to have this education be continuous across the lifespan.
And is this something that a professional needs to do, or is this something a parent can impart?
So the work that we are involved in really is in schools, because we can guarantee, that 99.9% of all children are in school at least for 6 to 8 hours a day, and we can give them that sort of standardized emotion education.
So can you give us a little glimpse of what that education is like? What do you mean by that?
So what we mean by that is we want to teach children a set of skills. The skills that we work on are the ability to recognize the emotions they're experiencing, have them be able to understand why they're having those feelings, giving them the vocabulary so that they can really differentiate the feeling of sadness from disappointment or anger from frustration, as well as positive emotions. Also teach them how to express themselves in a healthy way, and very importantly, I think for all of us, are the strategies to regulate emotions.
How important is it for the teacher, if you will, to have these skills?
From our perspective, it's really critical for the adults who teach children to have the skills that they're teaching. So in our model of bringing emotional intelligence to schools, we really work with leaders first, then teachers, and students and their families after.
We were kind of talking about the tornado here in the Midwest earlier tonight, and it's who couldn't get behind a child who has survived a tornado? That's something that everyone gets on board with. Is it a little harder? Does people shy away on a personal level sometimes of getting involved in a child's mental health?
I think they do, because they haven't been taught the skills they need to interact effectively with children. So that's why our approach really is about developing the adults first, so that they have the emotion vocabulary to speak to children, that they have the strategies that they can model and then teach to children.
So what are kids doing to cope? I'm sure, whether they're taught or not, they're going to do something, either good or bad.
Of course, there are effective strategies and ineffective strategies. We know a lot of kids, when they're traumatized or when they're in pain, ruminate. A kid who's being bullied is just ruminating all day. How am I going to get home safely? How am I going to get to this class without being hurt? Or in a traumatic situation like you're talking about, they're ruminating about their own homes and their families, where we want to try to teach kids to use techniques like positive self-talk or what we call positive reappraisal, where they can change the storyline to help them cope more effectively.
So how do kids make for students in this area? Are these skills that they can pick up fairly easily?
We believe they are, as long as they're taught effectively and they're practiced. So you need to practice these skills and get feedback and catch yourself, right? So when I'm ruminating about something that's really bothering me, I have to take that moment and pause and say, okay, wait a minute, use your positive self-talk here. So it's something that takes time, but certainly is accessible and doable for children as young as 3 years old.